Imagine a scenario when you have multiple IVF failures and you have embryos remaining, and embryos are thawed and then biopsied and sent for genetic testing. Does that impact results? Routinely, embryos are biopsied first and frozen unless you already have frozen embryos, in which case you would then thaw the embryos, biopsy them, and refreeze them. The reason why this question is important is because there have been more and more cases where, when IVF has failed multiple times, you have looked at the remaining embryos and biopsied them. And this review has been quite a systematically reviews and gives us a comprehensive understanding of how embryo manipulation, freezing, thawing, or then rebiopsy may have an impact on results. So they conducted a systematic review and meta-analysis of all the existing studies, and they checked the medical databases, focusing on studies that compared the different types of embryo biopsies and vitrification. The analysis included 9 studies involving approximately 24,158 IVF cycles. They compared embryos that underwent a single biopsy and single vitrification, double biopsy and double vitrification, a single biopsy and double vitrification. And this is looking at almost all the scenarios that are present. The study discovered that the pregnancy rate with double biopsy and double freezing, or single biopsy and double freezing, affected the chances of pregnancy. So when you have a look at the chances of pregnancy, it seems that the chances of pregnancy were down to, with the double biopsy and double vitrification, a 28% reduction, and a single biopsy and double vitrification of 21% reduction in live birth rates. So, what do we tell our patients? That if you do tend to do a repeat biopsy, then you're going to have a slightly lower chance of pregnancy compared to when the embryos have been biopsied much earlier. And I think as long as patients are aware that success rates may be lower, I think genetic screening does give you an idea whether these embryos are good enough to replace or not.